In the House, it's Senator Chad McMahan, who is chair of Local and Privates. We have an injury list here, I think, on Representative Jess Hale. Who? What happened, Chad? Did he get? Did he get COVIDated, or do we know?
Well, first of all, good morning, Mississippi. It's wonderful to be here. Paul, thank you for the opportunity to come on and exchange ideas and thoughts. Representative Hale was unable to join us. He's not feeling well. He did have a COVID test. It was negative. But, you know, he just thought he would side on caution and not jeopardize anyone else's health.
I think it's a good idea. Yeah.
So,
Dr. Katherine Pannel is a psychiatrist and also Board of Trustees, MSMA, the Mississippi State Medical Association. Doc, good morning to you. How are you?
Good morning. Thank you for having me.
Now, I know you have got to head out fast, so we only have one segment here to talk about. And I do want to talk about this, the bill. Is that what you would like to concentrate on as far as the bill that's called the Right to Visit Act?
Yes, that's correct. Right to Visit Act.
All right. Tell me a little bit about this, because we haven't heard of it before. I know when we talked about this, Chad, on texting back and forth, it was I looked it up and I had to get familiar with it's called the Right to Visit Act. Tell me a little bit about it.
Well, I think the pandemic has highlighted a lot of areas in Mississippi where we need to improve upon things, and one of those things is hospital and nursing home visitation. For many months, visitation was essentially stopped to prevent COVID infection from spreading, which left a lot of patients, alone during their hospital stays, and some dying alone. And physicians just feel like it's critically important, especially during a pandemic, for our patients to be able to have a loved one at the bedside for support during one of their greatest times of need. And we're just super thankful for Senator McMahan agreeing to sponsor this bill.
I'm telling you, when we go back and look at this in history, and I hope it's pretty fast, it's going to be one of the saddest things, because especially if you've been married for a long time, or if you got your child in there, not to be there to hold hands and to work through this. And Chad, I mean, physically, medically, if a doctor or nurse can get in there ought to be a way for that to happen.
Well, the Physicians Association brought it to my attention that part of healing is being able to interact with your loved ones.
Bingo.
And part of dying is to be able to interact with your loved ones. And during the pandemic, I had constituent after constituent that contacted me weeping that they could not see their loved ones, their spouse, their mama, their daddy, their grandparent. And it's not just in hospitals. This particular legislation will deal with any CON, which would also include nursing homes, assisted living, hospitals. But our medical community has done a wonderful job during the pandemic. Early on, we didn't know what we were dealing with. But now we have a lot more science. We know that protocols can be developed so that loved ones can interact. And I'm going to tell you, everybody deserves to see their spouse or their mama or daddy if they're in a healthcare facility in this state.
Dr. Pannel, the Bill of Rights is written in a way that it protects that establishment from any lawsuits. Am I right about that?
You're correct. And it also gives hospitals and nursing homes the full control and ability to establish the criteria for these designated visitors to be able to see their loved ones. So they still do have full control over what it takes to have them come in.
Guys, are we broaching any federal laws on this one, or that's nothing in statute? Mr. Biden changes things so fast, I have to check on that every once in a while. But this is not overriding any federal law, is it?
Not that I'm aware of. In fact, CMS has recently come out with new criteria in nursing homes that actually say that, you should be allowing visitors. But again, it gives guidelines on how you should, what guidelines you should follow to make sure that when you do go visit, you're doing it safely.
What else does it say in this bill?
Basically, it's a very simple bill. It's only 3 pages, but if you are in a CON facility, that for every 24 hours there, that a loved one must have access to that person for at least 2 hours.
Is this in Hobbs committee or Hobbs in public health and welfare?
I dropped the bill last week, but it was assigned to committee last night, and I'm not sure which committee, but I'm a member of public health, and I feel like that's where it will end up, in public health.
So this will become effective immediately or July the 1st, if it's signed?
I believe it's upon passage.
Upon passage. Anything else, Dr. Pannel, that you want to mention here? And by the way, as with the MSMA, tell me what the overview is as far as COVID right now that you know.
We're not out of this yet. You still have to be safe and do the social distancing, the masking, the good hand hygiene, and vaccinations are of utmost importance. We're not out of this yet.
How many people have you seen or you heard that have been admitted to the hospital? Is there a percentage of those?
I don't know an exact percentage. I'm in psychiatry, but I've had a lot of patients come in that have either had COVID and now are struggling after that with their mental health, or either have had a loved one, with COVID or pass away with COVID. Several patients.
I did see something new yesterday and data's coming in all the time. Mm-hmm. I saw something new yesterday that said if you had Delta, now some of the data is showing that if you had Delta and also had your shots and boosters, you have actually got a better immunity system against Omicron or whatever the next one may be. Have you heard anything else about is there another one on the scenes somewhere that the Medical Association is worried about?
You're always hearing of another strain, and things are changing every day. So, we're always looking out and watching for the next one, but hoping that, with more vaccinations and increasing herd immunity, that we, see an end to this.
I think the best thing I've heard is that one of the companies are working on a vaccine. Unfortunately, it won't be available till not this fall, but next fall. Maybe they meant this fall, I'm hoping. They said basically it's a combination of flu and COVID together in one shot, which is a pretty good idea.
Right. The Flumicron is going on right now,
Flumicron, right? Yeah. But the easiest thing to do is give a name to something like that with creativity. But our cases this morning, 8,000. This is a one-day total, 8,460. COVID-related deaths, 48, and that is a one-day total. I say one-day total, but I'm not sure how many days it goes from the certificates and everything else, or the certifications of that death. Chad, anything else on this as far as the Right to Visit Act? By the way, you haven't got a bill number yet?
It was assigned to committee last night, but I don't have the bill number. Yeah.
Okay.
But I do want to share that Representative Jeff Hale from DeSoto County, this is very important to him. His own father last year went to be with Jesus. He died. He slipped into eternity, got to go be with Jesus, but they didn't let him see his own father for almost a month. And there's a lot of passion around this for him. It's important to him. But I have constituents that didn't see their loved ones for 13 months. They looked at them through a window, but they could not interact and love them, their mothers or grandmothers or dads. So this is really important to Representative Hale, and it's important to me.
And you are saying that this covers not all CON establishments, as well as nursing homes and things such as that.
That's correct. And I do want to brag on the CON facilities in this state. They have done a wonderful job during a very difficult time when we didn't have a lot of science and we didn't know what we were dealing with.
Well, when you talk about instances of how many people have died that may have that experience, how many of them we've had a total, and I was looking here, total deaths in the state of Mississippi since that COVID began to be tallied, 10,690. So I'm sure there are a lot of those people and their families. By the time you put that together, it is tens of thousands. Dr. Pannel, it's always good seeing you.
You as well.
Thank you.